Dr. Siddha Chakra. It's my privilege to introduce him. Sir is very well-known anesthesiologist and has received many awards. He is retired as Additional Director of Medical and Health Science from Hyderabad in 2009. He received Dr. A.P. Singhal Lifetime Achievement Award at SZISACON2023 held at Ahmedabad. He received Dr. A.K.N. Sinha National Award from Indian Science, Technology and Innovation 2021 held at Patna. He received IMA Distinguished Service Award at 2022. He was appointed as Indian representative of ILCAR World Restart a Heart Committee in 2022. He was the chairman of IMA National Standing Committee for Resuscitation. He was the chairman of Indian Resuscitation Council Federation. He was also the chairman of Indian Resuscitation Council, which started our own Indian guidelines for resuscitation. He was a member of Constitutional Committee of World Federation of Anesthesiologists between 2016 to 2024. He was a...
Thank you. I'm the past president of the Indian Society of Anesthesiologists. By virtue of that, many people have tried to form the Indian guidelines for resuscitation. And finally, the ISA has asked me to formulate some guidelines. In 2017, I have brought these things with a meeting, inviting many people around in every part of India, and we have brought these guidelines. In these guidelines, actually, they are very custom-made, suit to the situations in India where there is no awakening of the emergency medical system, where the ambulances will not respond to our calls, where there are no roads, where we do not have any specific system of implementation of an emergency, where we have a lot of superstitions, where we have different religions, and we have literacy, but we do not follow. We have myths, we have fallacies. We talk about the 2010 American Heart Association guidelines and try to implement now in 2023. So we have come with our own guidelines. These guidelines are nothing new. It is almost the same. But what is important is when we are attending a patient, a victim, definitely when there is nothing is there, what we have to do. That is more important, because we do not have AEDs and we do not have ethic for the ambulances. Nobody will give a way for the ambulance to come fast, and they will be entangled in the traffic. So in those circumstances, what we have to do? So it is the pre-hospital CPR that we have given a lot of importance, and the CPR within the hospital is same anywhere in the world. So now they have asked me to talk on these special situations. Of course, already I have consumed about 5 minutes. I'll go fast. This is our Modi, the Prime Minister of India, who is bringing out some changes. He has come with the word Atmanirbhar Bharat, the self-reliance India, where you have to make everything by yourself, where we have to improve by ourselves. This is the special situations. Only two special situations I'm going to talk here because of the paucity of time. So the pediatrics is one of the things. Pediatric, that means the infant and the children can have some water. Infant and children, the situation is, of course, the physiology and everything is same. The only thing is the framework of the child. Hello, am I audible? Rules are same as adults, and the scene safety the checking of the responsiveness, call for help, high performance CPR are the issues that we have to take up. And the differences are due to the anatomy, physiology, and the cause of the cardiac arrest. Here, mostly the cardiac arrest is a respiratory cause, and you have to check for the safety, check for the responsiveness by tapping the shoulders of the child. It is same like an adult, but here in infants we tap on the feet and activate the emergency medical system. So you call for help, you call for another good fellow or an experienced man that is there, and it is same. They assess the breathing and pulse for every 5 to 10 seconds. So this is important, and in child, the carotid or femoral pulse you can see, and in infant, the brachial plex pulse is important. You have to see for the breathing and the pulse and monitor it, and no breathing, no pulse, provide one breath every 2 to 3 seconds, and that means 20 to 30 breaths per minute. And if both the pulse and breaths are absent, start CPR. So here 30:2 with a single rescuer and 15:2 with double rescuers. This is the difference. And another thing is, in the pediatric group, the compression rate is 120 per minute, and the depth is around 4 centimeters in infant and 5 centimeters in children, and 1/3 of the anterior posterior width of the chest. Allow complete recoil in between the compressions and minimal interference. So the interference is most important, because here our aim is to see that the brain gets the circulation, so the interference should be minimal, and if there is any interference, it should be in few seconds. That is about below 10 seconds or 7 seconds. Technique, child, same as adult, and in small children can use only one hand. So one hand technique is here practice. So CPR in pediatrics, chest compression in infants, compress with 2 fingers below the nipple line at the center of the chest with one rescuer, and with both the hands supporting the back, the compress with both the thumbs in 2 rescuers. So somebody will be holding, and one person will be pressing, as is shown in the diagram. So here the key point is breaths are important, as the arrest is usually due to respiratory cause, and deliver effective breaths. Keep infant head in the neutral position, as the hyperextension can also obstruct the airway. If it is a witnessed arrest, so if it is in front of them, it has happened, get the AED and defibrillator as soon as possible. And if it is an unwitnessed cardiac arrest, start CPR first and then call for help. So if single rescuer, we having the meeting of ILCAR in Delhi, and there the guidelines will be written again by the American Heart Association or the ILCAR. Thank you very much for patiently listening. How many of you are trained in CPR? Certified? Valid certification? Every 2 years you are taking a renewal? Good. I am very happy. It is not you only get trained, you train your family members, your children, your servant maid, your relatives, your friends, and all the people who are actively involved with you, because they are the people who are going to save you. And a building like this, spending crores of rupees, I'm sorry to say there is no AED here. If something happens, like Abdul Kalam giving a lecture in 2015 at Shillong, he suddenly collapsed and nothing could be done. And in any of the conferences, actually in those days of our good old senior, he used to tell at least an ambulance should be ready. Of course, in those days we do not have AEDs. Even now we don't have AEDs. In those days we have only the pedals and unidirectional defibrillators are there. So at least an ambulance should be ready. And in national conferences, we are insisting on keeping an ambulance. But I think every big complex should need a AED. So that is what I wanted to convey you. Thank you very much.